So uh, the total length of stay, um, that is to say, the total discharge days. So the number of days of care are rendered to a group of inpatients from admission to discharge is what we refer as the total length of stay. So the sum of the length of stay of any groups of inpatients discharged during a specific period of time. So for instance, if a patient is admitted in the facility on Monday and is discharged on next Monday, so that means the patient has stayed in the facility for a period of 1 week, and that is 7 days. And but sometime could be considered as 14 days, just like what people do in prisons. Calculation is made on day and night. So, for instance, in prisons, if you are given 1 year, 1 year is those are 365 days. So 365 days is divided into two, which means days and night are calculated as 2 days. You get it? So number 22, we have the total patients days that sometimes we refer to as total inpatient service day. So that's a sum of all inpatient service days for each of the days during a given period of time. So this is taken from the census form. Every inpatient receives one inpatient service day each day he or she is hospitalized. So at a total inpatient service day, depending on how long the patient has been in the hospital or the patient has been hospitalized. Now number 23, we have transfer. We define transfer as the movement of a patient from one medical care unit to another within a hospital. So transfer would mean, for instance, if a patient was admitted as an outpatient, and then the conditions increases and is he or she end up being admitted or transferred to the unit of inpatients, that is transfer. Of course, the other one we also have referral in and referral out. Okay, so transfers to another healthcare institutions are classified as discharges. So, for instance, if your patient is admitted to to, let's say, Kabale Referral Hospital or Kabale Health Center 4, and then the patient is being after Kabale realizes that they cannot be able to handle the situation of the patients, and they decide to transfer that patients to Mulago Hospital, for example, that is this is classified as discharges. So the discharges, how would you know that the patient has been transferred to another hospital using the classification of discharges? So there the indications is there under the discharge status. So the discharge status would be showing that the patient has been transferred. All right, so next, which is 24, is what we are referring as underlying cause of death. So the underlying cause of death is the disease or injury which initiated the train of morbid events leading directly to death, or the circumstances of the accident or violence which produce the fatal injury. So the underlying cause of death is what actually happened and lead to a particular death. It could be very direct or it could be indirect. When it is direct, it means, for example, someone land or maybe get an accident and die at spot. You get when somebody get an accident and die at the spot. That is the direct underlying cause of death. So there, the direct underlying cause of death is the accident. Now, for instance, if somebody get an accident and then is admitted in a facility, he or she takes a good period of time in the hospital, and then he dies after maybe 1 month. Still, accident would be the underlying cause of death. So even if it is accident, even if it is violence, as long as it produces a fatal injury that could lead directly to death or indirectly. So that is referred as underlying cause of death. In most cases, we really don't do the calculation of underlying cause of death. They are all regarded as death rates in the facility. But it's simply put as underlying cause of death because that helped in investigating or maybe tracing the actual cause of death of a particular patient. In most cases, it's one of the reasons why a patient, when somebody die, it doesn't matter, accident, suicide, whatever it is, they must be taken to the facility for postmortem so they can be able to figure out what are the underlying causes of death for such a person. It's very important. Now, we are moving forward by looking at inpatient statistical data collections and their calculation. So there are a few things that is done, and this is very important. Uh, Data that are collected within the inpatient department and how the calculation is being made. Okay, so I want you to pay attention. So I want you to be very attentive on this. All right, so inpatient statistical data are routinely collected and calculated in the hospital on a monthly and annual basis. And of which this includes number one, we have number of admission. So number of admission is one of the statistics that are also calculated in the facility. So number of admission, that is to say total hospital and by service. So we want to know at the end of the day, at the end of the week, how many people that we are able to admit in our facility for the week, for the month, or for the whole year. Number two, we have number of patients days. So we want to know out of these patients, how many of them spend how many days in the facilities. Numbers of discharges, those one who were discharged alive, and those that were discharged expired or dead. That is the total hospital and by service. Another calculation that is also very vital is number of deaths. So it is very important to know how many patients we have lost in a facility so far in a week, in a month, and what causes their death. All right. So this help a lot to improve on the quality of services and the kind of the services that need to be provided, basing on the frequency of the disease, the frequency of morbidity, the frequency of mortality in the hospital. So another thing that is also calculated is the number of deaths. I've talked about that already, sorry. The total length stay or the total discharge days. Okay, and also want to look at the number of the autopsies, and then we also want to see the number of the coroners or medical examiners cases, and also want to calculate the number of deliveries when you're focusing on obstetrics patients, the patient that were under gynecological or maybe the management in their pregnancy periods. This help in monitoring and also analyzing if the management of the pregnancies in the facility is very effective and maternal child health. And then we have number of live birth. How many children were given birth in our facility alive? Okay, and how many of them that were given birth and they died, the fetal death? And number of obstetrics discharges. I said before that obstetric is the caring of pregnant mothers and their newborns, or maybe the caring of the mothers and their unborn babies. So we have also number of maternal death, those one that die as a result of anything that is related to pregnancy. It could be abortion, could be miscarriage, could be deliveries, and the rest. And also we have a number of prenatal death. number of surgical procedures, number of anesthetics administered, and then all those informations we have their calculations. I'll put them down there in simple way, and of course I believe that you'll be able to understand them simply. All right, so in the hospital utilizations, what are calculated are daily census, average daily census, average length of stays in the inpatients, of inpatients, percentage of occupancies of hospital beds, turnover intervals, and turnover rates. And also we have death rates, whereby the hospital death rate is calculated, the net death rate is detected, the post-operative death rate is also necessary, and also anesthesia death rates. These are the patients that would die during operations or after failing to recover from the operations as a result of anesthetic-related problems. Then we have the outpatient rates, hospital outpatient rates, and then net outpatient rate. And we also have obstetrics and prenatal rates, cesarean section rate, maternal death rates, fetal death rate, and then prenatal death rates. So the above rates and percentages may be calculated using the following formula. Right. So hospital utilization, number one, we have a daily census or maybe daily bed occupancy. So the formula is census is equal to inpatient admissions up to discharges or death remaining at the next between census midnight plus census hour taking. So straight away to the formula, we have the total number of patients day for a period, except newborns. We don't calculate the newborns. Okay, the total number of patients days for a period over the total number of days in the same period. So this what happened. For example, we say in May, the hospital rendered 4,280 patients days, excluding new babies. We said that newborn babies is not calculated. Newborn babies is also calculated separately. So May has 31 days. Get it? May has 31 days. And then we have the total hospital patient who came were actually 4,280. So this is a very simple calculation. We just divide the total number of patients by the numbers of hospital days, which is of that month, which is 31. Okay, so when we divide 4,280 by 31, what we get is 138. Okay, 138.06 or maybe 0.1. So this would be rounded to give the average daily inpatient census during May, which is 138 patients. Okay, so one thing you need to know is that this indicator is calculated separately for newborn. So like I said before, our calculation does not include newborn. Very simple calculation right there. And I believe that is also simple with you. Just get a pen, then you read this example thoroughly, and also you master the formula. Okay, you master the formula of daily census, whereby the total number of patients days is divided by the total number of days in the same period. So if you are calculating a number of the periods of, let's say you're calculating the daily census, the average daily census of January, which is the last month, you get the number of the admissions, which may be 100,000 or 50, whatever, and then you divide it by the number of days in that very month. Okay, so for example, in Feb, this is Feb. How many days do we have in Feb? Could be 28, could be 30, whatever it is, and then you divide it by the total number of patient days for a period. But always remember that we exclude newborn babies out of this calculation, and we do their calculation separately. All right, so still under hospital utilization, we have the average length of stay, which is ALOS, of discharge patients. We are calculating how long as those patients stayed in the hospital after they have been discharged. Now, the average number of days that inpatients exclusive of newborn, I still repeat, exclusive of newborn, okay? So this is the formula, all right? And what you need to understand is you need to understand what are you calculating, okay? And if you get what you're calculating, you need to get formula. You get the formula, right? If you get the formula, getting the answers becomes very easy for you. So how do we calculate the average length of stay? This is a formula. The total length of stay of discharged patients for a given period of time. Right? So how long does the patients stay? How many patients were actually discharged? Could be including those ones who are discharged alive and dead. All that matters is they were discharged. So this is the example. Uh, in June, a hospital discharged 2,086 patients, including death but excluding newborns. Okay, so their combined length of stay was 13,654 days. Using the above formula, the average length of stay of these patients was 13,654 divided by the total number of discharged patients, which is 2,086. So when you divide that, you will get 6.5 days. Very, very, very simple calculation right there. It's a very simple calculation. All right, then we are moving forward by calculating the percentage of the occupancy of inpatients beds. All right, we want to find out how many beds were occupied for a certain period of time. So the formula is the total number of the patient's days for a given period of time multiplied by 100 divided by available beds or maybe completed beds time the number of days in the period. Okay, so for example, a hospital with 210 available beds excluding newborn base nets rendered 4,780 patient days in June. And June has how many days? 30 days. And by the way, all these numbers is always there. Now, when you are there in the facility, you just need to know which month are you talking about. Check on your calendar and find out whether it has 30 days, there are 31 days, or maybe has 28 days, so you can be able to get this correctly. The percentage of occupancy for a hospital in June was, like we said, basing on the formula, okay? Like we said, according to the formula, this is what we have here. So we have the 4,000. The formula says the total number of patients, the total number of patient days for a given period of time. So what's the total number of patient days? We said rendered 4,780 patient days. So the patient days is 4,780. All right. So we write that one here. And we say it is multiplied by what? By 100. So we have 100 here. And then uh, divided by available beds. How many beds do we have? We available beds, there are 210. Okay, the available hospital beds, there are 210. All right, time, the number of days in the period. Right, so what are the numbers of days in the period? All right, so we have 30,680. Now, how do you do this? You calculate, you multiply the 4,000 times what? Times the 30. Okay. So when you divide this, this is what you're going to get. This is what you are going to get. So you multiply, you divide this by 100, okay, and then what you will get will be this, and then you divide by the total number of beds, and then you multiply by the number of days in a period. Okay, then that will give us 700, I mean 75.9 or 75.87. But of course, if you round it up, it will give you 75.9. Okay, get a pen, get a sheet, follow all this, and then you'll be able to do it by yourself and make a calculations. Okay, otherwise it may look difficult, but it's a very simple calculation. All right, so then we have bed turnover interval. Okay, so average period in days that unavailable beds remains empty between the discharge of one inpatient and the admissions of the next indicates the time that available beds are free. So indicates a shortage of beds when negative, and underuse of the hospital, or insufficient admission system if positive. So we get a formula right here. The most important thing is, like I said, you need to understand on the formula. That's simple. So the available beds times days in a period minus patient days for a period divided by, over number of discharges, including death in a period of time. So, for example, a hospital with 210 available beds in June rendered 4,780 patient days and had 736 discharged or died patients. The turnover interval rates using the above formula is, we get here the available bed 210. All right, multiply the total number of days in that very month of June, which is 30, all right, and then minus, okay, minus the patient days, which is 4,780, all right, divide by, what are we dividing with? That is 736, okay, 736, and that will give us 2.06. 2.06. Get your calculator and then you divide that and then you multiply. When you round it up, it will give you 2.1 days. That is the turnover interval. And then we get bed turnover rate. So the mean number of patients passing through each bed during a period indicates the use made of available beds. The formula is number of discharges or separations in a period divided by, forget about this, okay, grab this, number of discharges or separations in a period divided by available beds. Very simple. So during the month of June, there were 736 discharges, including death, from a hospital with 210 beds. So what is the turnover rates for June? You divide the total number of discharges by the total number of available beds, and then you'll be able to get your answers straight away. Number two, we have death rates. Note that the patients who are dead on arrival, DOA, at the hospital are not included when calculating these rates. I repeat, if you're calculating death rates, you do not include the patients who die at arrival. Hello? All right. So we have the hospital death rates, a ratio of all inpatient death for a given period to the total number of discharges and death in the same period. We got a formula. The total number of the total number of death of inpatients in a given period divided by 100 over the total number of discharges and death in the same period. For example, a hospital had 15 deaths during the month of June. A total of 540 patients were discharged, including the 5 deaths during the month of June. Okay, so the total death rates according to the above formula is 454, 540, which is the total patients who was discharged, equal to 2.7. Okay, and then you multiply by 15, which is the total death rates in that very month. If you multiply and then you can be able to also multiply it again with 100. Okay, so we have the net death rates. So a death rate is also known as institutional death rates that does not include death, which occur within 48 hours of admissions. Okay, 24 hours of admission in some countries, so we don't know. But basically, in our countries here, we normally consider 48 or sometimes even 24 hours. So if a death occurs within 48 hours, that is 3 days of admission, should not be counted because not enough time had elapsed to allow the healthcare providers adequate time directly affect a patient's condition. However, with today's technology, this concept is no longer thought to be valid. Therefore, it is recommended that net death rates not be calculated unless there is a special order to do so. So of course, if there is need for that, then you can use the formula to do that. This is a very simple question. I mean, this is a very simple calculation. I really don't need to. Uh, this is what you can do. I mean, this is what you can do. Just take a look at the example very well, get it, understand the formula, and then you can be able to really make a very simple question. I mean, a simple calculation. Nothing hard from there. There is nothing, absolutely nothing, nothing hard from there. Okay. So you people, you need to look through this and then be able to do the calculation. I mean, just need to don't be lazy. Come on. Read the things, understand the formula. The most important thing is the formula. Just know when we talk about the turnover interval, what is the formula? How do you calculate that? Don't forget the formula. All right. If you know the formula, the set of the questions are very, very, very different. Very, very, very different. Okay. So when you get that, definitely you can be able to make everything very, very simple for you, all right? For you, and for you. What you need to know is the formula, okay? The formula, talk about maternal death rates. What's the formula? You just go straight to what's the formula, okay? What's the formula? The total number of maternal death for a given period of time, time 100, the total number of obstetric discharges, including death for the same period. And if you don't understand the formula, nothing can work for you. Nothing, like nothing, extremely, nothing can work for you. So what you need to know is a formula only. Just need a formula to be able to do the calculation. So what I will do next is I will be able to do this outpatient statistical data calculations, I mean data collections and calculations, and of course after that we can be able to move to a new constraint as well.